This video is going to go over static stretching and PNF stretching, which is also known as proprioceptive neuromuscular facilitation. So starting with static stretching, research has changed multiple times since the early 20th century, and static stretching at first was known to induce improvements in athletic performance, improve flexibility, and should be included as an integral part of a warm-up program. And this was shown from Chabin. But in the late 90s and the early 2000s, research found that static stretching induced acute and transient declines in strength and power, and it should not be used and to consider dynamic stretching instead. New research, though, has found that static stretching can be beneficial when part of a full warm-up and can cause trivial to no negative effects when done for less than 60 seconds per muscle group. And that was from Chabin as well. When static stretching should be used, it should be done after the muscles have been warmed after completion of an exercise program, or as part of a warm-up program before the exercise program has been started. And according to Chabin, static stretching should be used as a fundamental warm-up component before recreational sports participation, and it should be used with caution in high-performance athletes because it has been shown to decrease performance. Pros of static stretching, according to Chabin, is less than 60 seconds per muscle group causes trivial to no negative effects on subsequent strength and power. They also found that static stretching as part of a full warm-up increases flexibility and may even contribute to lower the injury risk. Cons of static stretching, according to Chabin, shows that a large body of scientific evidence has recommended not to use static stretching immediately before the performance of strength and power-related activities, and this is based on evidence showing acute stretch-related declines in muscle strength and power. This study also found that this mostly happened when doing static stretching for over 60 seconds. Under 60 seconds actually showed no trivial or no negative effects. PNF stretching, or proprioceptive neuromuscular facilitation, according to research from Lim, numerous studies have examined the effects of PNF stretching in relation to the duration and frequency of PNF, and several recent studies have examined the effects of PNF according to stretching intensity. Some studies have found that not only high intensity, but also low intensity stretching significantly increased flexibility, no significant differences between the two groups. PNF stretching should be done after the muscles have been warmed, after an exercise program has completed, and after inhibitory techniques have been completed. According to Lim, moderate intensity stretching is recommended to maintain the effects of stretching while ensuring safety. Pros of PNF stretching, or proprioceptive neuromuscular facilitation, according to Lim, shows that PNF is known to be more effective than other stretching techniques in that it increases both passive and active flexibility and improves range of motion in the short term. Cons with PNF, according to Lim, shows that PNF is often performed at high intensity in clinical practice in order to maximize the improvement in flexibility. However, when repeatedly performed, it may induce muscle tissue damage. It was also noted that high-intensity stretching can cause severe pain in muscle tissue, and this may cause discomfort during exercise and consequently hinder muscle performance. So that was going over static stretching and PNF stretching.